Hi, I'm LaKeisha Lewis. I'm a senior dental assistant mentor with Heartland Dental. Today, we're going to cover tips that will help dental assistants assist doctors to do root canal therapy more efficiently. The key is organization and the ability to think ahead. Understanding the primary steps of a root canal will help you with not only your setup of the procedure, but also in anticipation of the next steps. Let's start with the steps surrounding a procedure with Wave 1 Gold. This is a popular instrument system. We'll also talk about using a carrier-based obturation method known as Gutta-core. In diagnosis, our role as assistants revolves around the radiographs. The doctors and the patients will be making treatment decisions and plans based on the accuracy of our images, so it is very important. Having a correct x-ray means making sure there is a periapical image and not just a bite wing before the doctor starts. This will get the procedure off to a smooth start. Having quality x-rays means making sure the doctor can see the entire tooth, including the apex. Be sure the x-rays is taken at the correct angle. In the course of a busy practice day, the least amount of holdups or redos we can have, the better. Let's talk about endodontic access next. Before we start a root canal, have you placed the rubber dam? This is the standard of care expectation. It allows the doctor greater tooth isolation and visibility, as well as a huge measure of safety for the patient. Placing the rubber dam for your doctor will reduce time, allowing the clinician to start right away. The recommended clamps are the 12A and the 13A. These clamps are universal, meaning you can isolate all 4 quads just by using 2 clamps. Another critical step is making sure all the burrs needed for the endo are included in your kit. Here is a list of the most frequently used burrs that should always be ready to go. After access, be ready for instrumentation. Have your RC Prep or Pro Lube ready to use. It will be needed frequently. As I mentioned earlier, knowing the Wave 1 Gold system will help you determine which files your doctor may need during this process. You'll be more confident throughout the procedure as you help keep things moving, making for efficient chair time and a better patient experience. You'll always start with the red primary file. From there, your doctor will tell you if they need other instruments based on the anatomy. That said, you don't want to open the files until you're sure which ones you are going to be called for. The Wave 1 Gold instruments are pre-sterilized for one-time use and are not autoclavable. You don't want to waste any files, so be certain what direction the doctor is going in. After the instrumentation phase is complete, it's time to fill the canal space. The doctor can generally reconfirm the working length with the apex locator. The canal should have some irrigating solution in it when the Gutta-core size verifier is handed over. Once the size is confirmed, go ahead and set your stopper on the corresponding obturator at working length. Use the calibration rings for a more accurate measurement. This is an example of anticipating the procedure and working ahead. The final irrigation of the canal space is a critical part of the procedure. This is when we are washing away the bacteria and debris that have been removed and preparing the canal for a complete filling. Having multiple preloaded syringes ready to use minimizes the time. You don't want to have to stop and reload your syringe. Have your paper points open and cotton pliers ready to hand to the doctor to dry the canal. Again, be prepared for this. For obturating with a carrier-based method like Gutta-core, have sealer ready to go. With the Gutta-core obturator sizing confirmed, you can put it in the oven and start the heating cycle. Only do this when you know the doctor will be ready for it. The heating takes less than a minute, but can only be kept in the oven for about a minute after the beat. Restoration completes the case. Usually the goal is to bring the tooth back to function, but there will be occasions when the restoration will be temporary and the ultimate treatment plan calls for a new crown. Have your preferred composite build-up materials ready. Don't forget your etch and bond cement. And power up your curing light. Is your matrix system handy and ready to go? Just in case, the doctor needs to be ready to react and respond. And that means they will rely on us for that flexibility when needed. There are a handful of other ideas that can make the endo in your office more efficient. Here is a picture of a cart that is dedicated to endo. It has all the items that are related to the procedure which don't need to be sterilized. You should also place rubber dam clamps in your restorative kits. A great time saver is to preload sponges with your doctor's standard hand files. And finally, make sure you have several preloaded irrigation syringes stored in your cart. Endo is a team game. Your work as an assistant plays a critical part in the success of the treatment. Implementing these steps will help you be more prepared, confident, and help your doctor be more efficient with these procedures.